Dr. Lexi Hill, maternal fetal medicine specialist and medical director at UMA Health.
When we have individuals who have been diagnosed with preeclampsia, how do we manage them postpartum? They should not be discharged quickly. That's the one thing to know for certain. So they should stay at least a full day after their birth. So again, no discharge under 24 hours is a really great base recommendation for these individuals, and they may need to stay even longer. If they have been on magnesium during a part of their labor, the general recommendation is you continue this magnesium for 24 hours postpartum and continue to monitor their ins and outs as well. Manage their hypertension. This is one that's very important. So oftentimes when the delivery occurs, we think that we're supposed to still only use our antihypertensive medications that we recommend during pregnancy. We now have a postpartum individual. So we need to work on treating those blood pressures with the correct antihypertensive that's right for the patient. All women with hypertensive disorders do need close follow-up. Once they are discharged, they need to be followed up within the first 10 days after that delivery. If they had severe blood pressures, some type of systolic blood pressure greater than or equal to 160, diastolic blood pressure greater than or equal to 110, these individuals should be followed up within the first 3 days after discharge from the hospital. That's a very important takeaway from this. And also we want to continue home blood pressure monitoring. So make sure they have a good cuff at home. Make sure they understand how to properly check a blood pressure, that the cuff is the right size, that they're seated, and that their arm is typically right at that heart level. They haven't had any tobacco or any exercise right before checking that blood pressure. And our goals during that time, we want that systolic less than 140, that diastolic less than 90. There may be certain patient populations, those with pre-existing hypertension, those with comorbidities or issues with kidney failure or kidney dysfunction, where we may want that systolic and diastolic blood pressure a little bit lower.